Heart health can be really difficult to track and manage, and it can be overwhelming to get started. In this video, we hope to provide you with some common lifestyle tips and actionable items to better your heart health. Our first tip, and one of the most commonly recommended important lifestyle changes you can make to prevent your CHF from worsening, is to reduce the amount of sodium in your diet. Sodium is really important in heart failure because too much sodium can cause your body to hold on to fluid. This fluid buildup makes your heart work harder. The fluid buildup can also cause swelling in your feet, legs, or belly, and fluid can also build up around your lungs, which makes it hard for you to breathe. If you have moderate heart failure symptoms or even worse, the American Heart Association recommends that you should intake no more than 2,000 milligrams of sodium every day. And some common examples of high sodium foods to avoid are processed foods, deli meats, and pickled foods. Choose natural foods because processing can add a lot of salt to them. Also, as a tip, consider seasoning your food with herbs and spices instead of salt. Our actionable item for sodium intake is to read nutrition labels before choosing what you eat. First, look at the serving size that you might be eating and compare this with the amount of sodium also present on the label. Choose foods with under 200 milligrams of sodium per serving or less than 8% of daily value of sodium per serving. Our second tip to better your heart failure is to limit the amount of fluids you drink. Just like with sodium intake, when you take too many fluids, this can lead to swelling, and this means your heart has to pump harder. If your heart is working too hard, this can lead to your heart not being able to pump properly over time. If you have heart failure symptoms, the Heart and Stroke Foundation recommends no more than 1.5 to 2 liters of fluid taken every day. And to reduce your fluid intake, it's very important to be aware of how much water you are drinking. And a really easy way to track your water is to get a reusable water bottle that you know the volume of. That way you can track how many water bottles that you're drinking instead of what volume you're drinking. So for example, I use a 500 milliliter water bottle, and what I can track is if I drink 3 water bottles a day, then I know that I'm drinking 1.5 liters of water. So our action item here for this tip is to invest in a water bottle that you can reuse. Also, avoid really salty and sweet foods because this can make you thirsty. So if you're trying to avoid cravings, stay away from those foods. Our third tip is to avoid drinking too much alcohol. Studies have found that drinking more than 1 alcoholic beverage a day can lead to heart failure. Alcohol can raise your blood pressure, raise your heart rate, and contribute to obesity, all of which can indirectly add to your heart's workload. However, a moderate amount of alcohol, which is around maximum 1 drink a day, has not been found to worsen heart failure. To manage alcohol habits, one actionable item you can take on is to set a drinking goal. A standard recommendation for drinking by Harvard Public Health is maximum 1 drink a day for women, maximum 1 drink a day for men over 65, and 2 drinks a day for men under 65. Once you set a drinking goal, it's really important to follow through. And a good way to stave off any cravings is to drink your alcoholic beverage slowly and mindfully. This will help prolong your satisfaction and decrease your thirst. You can also consider substituting your drink with water, tea, or juice.
Another really big aspect of your health that we want to consider is your sleeping habits, because poor sleeping habits can actually increase your stress levels and can increase your blood pressure. So it's really important to prioritize proper rest every single night. Generally speaking, the CDC recommends 7 or more hours of sleep every night for those between the ages of 18 to 60. Between 7 to 9 hours of sleep every night for those between the ages of 61 to 64, and between 7 or 8 hours of sleep every night for those aged 65 and older. So generally speaking, more than 7 hours is ideal. For naps, generally, studies suggest that a nap length of 10 to 20 minutes can provide you with that restorative sleep without that feeling of grogginess or drowsiness that you may sometimes experience. And one actionable item for this tip is to make sure that you schedule your activities for the day at times that don't overlap with periods where you should be sleeping. And this can make it easier for you to get those recommended hours of sleep. Another great tip is to be sure to include exercise as a part of your daily routine. And now every person is different, so be sure to check with your doctor as to what types of exercises are safe for you. But generally speaking, the CDC often recommends at least 150 minutes of moderate intensity aerobic exercise a week to actually lower your risk for developing cardiovascular disease. And remember, your heart is a muscle, and so aerobic exercise can actually improve the strength of your heart, and so it has to work less hard when you're not exercising. Additionally, on top of all of that, you can actually lower your risk for high blood pressure and even improve your cholesterol levels by having regular physical activity. For, actually doing the exercise, one actionable item is potentially considering going on walks around the neighborhood, maybe jogging, dancing, even playing sports, or even going on a brisk walk 20 minutes before or after work, or scheduling a hike with friends and family. Any way to make it enjoyable, but also be sure to get yourself out there and doing some form of physical activity. And finally, we definitely recommend patients weigh themselves every morning after emptying out your bladder and before having any sort of breakfast, as well as keeping track of your weight readings and bringing them with you to every doctor's appointment. Now, the reason we ask for patients to weigh themselves in the morning is because the reading that you get in the morning is the most accurate one you can get throughout the entire day. And this is because you've had that time as you've slept to digest any food that's been in your stomach, as well as, once you've woken up and you've emptied out your bladder, you've gotten rid of any of that extra weight that may impact your reading. And therefore, your reading is going to be more representative of your true weight. Now, it's very important to be keeping track of your weight because it gives both you as well as your doctor an idea as to how your diet and your exercise habits are impacting your health. But also it can indicate some other things. For example, rapid weight changes can mean that you're either gaining or losing fluid, which may be indicative of some issues with the heart. And so by having a weight record and keeping track of your weight regularly, you're able to help your doctor figure out what condition your heart is in and whether or not your heart is under control.